All right, I'm having a consultation with a fellow board member who is telling me that you all, okay, so I'm going to go ahead and continue here, and then we'll just post twice. It'll be 2 parts. Okay, bye. All this technical stuff. So Dee Dee had let me know that I wasn't being seen, so we will try and continue. But we were just discussing fish oil and how effective it is in order to, during your pregnancy, receive the amount that would be able to sustain both you and your baby. You would need to eat 1 pound to 1.5 pounds of fish, which obviously is not recommended with the different contaminants. One of the benefits that we do know that we have right now with the supplements is there is additional testing. So mercury levels are low, contaminants are minimized. And so I will also post a link below on some safe, those that are considered safe, safe companies to utilize for your fish oil. One of the things that I have to make a correction for, and I just recently learned, is that in the past for my vegan and vegetarian clients, we've always said that you could go ahead and substitute flaxseed oil. However, right now the research is stating that the ALA type of omega-3 that is in flaxseed is not beneficial, and it is not effective in treating nor preventing postpartum mood and anxiety disorders. So hopefully, I have one client who has described herself as a flexitarian and is open and willing to go ahead and have fish, or in having the fish oil. The other thing that we know is very, very important, that is something that is, again, well within your wheelhouse, would be exercise. In 2 studies done by Duke University, they have looked at exercise, and they've decided that the outcome can be as effective as Zoloft. Now, mind you, I am not telling anybody to get off their meds. Everything that I am sharing with you today, please go back and talk with your provider, have that conversation. But this is designed to educate you so that you can complete and be a part of your care and advocate well. So within the exercise, if you were considered mild to moderate, feeling depressive states, then you would, the suggestion is that you exercise 2 to 3 times, again, at a moderate level, so walking, maybe going around, and that exercise period needs to last from 20 to 30 minutes. If you felt that the depression and anxiety were so impactful that you're having a much harder time functioning, then the research was suggesting that you would exercise 3 to 5 times a week, and that your output needed to be anywhere from 60 to 85%. So I see you're going to break out into a sweat more so than somebody who is just doing, let's say, a casual walk. And again, that exercise period needed to last between 45 and 60 minutes. Again, we're going to keep in mind our wellness. And this wouldn't be something that you would do the immediate week after you've delivered. Your body still needs adequate time to rest, and we want to make sure that you're well that way. The other balancing supplements that we know that have been effective in anxiety and depression are also calcium and magnesium. Magnesium is a mineral that our bodies utilize, and it just helps with well-being. The recommended dosing for the magnesium that we've been talking about is like 500 milligrams. Natural calm seems to be something that is easy for women during their postpartum period to go ahead and have their bodies assimilate, and you would take that at night. Calcium would be the other one, and that's balanced. You take that 2 times a day, up to 1,200 milligrams. So maybe 600 milligrams in the morning, 600 toward the afternoon or evening. And again, everything that you read and hear and are made aware of, this is for communication with your provider, because they know the immediate ins and outs of your care for both your needs. And then last but not least, vitamin D. In the United States, everybody seems to be chronically deficient in vitamin D. This is something that your care provider can do a blood test and test so that you know. Right now, vitamin D has been shown to be very instrumental if we have your levels elevated into the proper range. Depression is minimized, anxiety is minimized, as well as your perception of pain. And so to me, those are all pluses when we're going through that. Vitamin D could be really easy to take. Again, I will post a suggested company, and it's 1 drop, and that 1 drop has 4,000 IUDs of vitamin D. And last but not least, of course, we know that breastfeeding is always at the top of our list, depending on your personal history, needs, and what has happened. If you can incorporate breastfeeding, breastfeeding is all around beneficial because it is also helping to reduce inflammation. And as you read, we're starting to learn how impactful any inflammation in the body is within our system. As you are preparing to deliver your baby, in response to having that baby, your body does raise the inflammation just to help you heal quicker. And then with the lack of sleep, or if you have any pain from the delivery, or the perception that things didn't go that way, or we have some psychological trauma, those also then raise more of our inflammational responses. So breastfeeding, when going well, is effective in reducing all of those things. And I stress going well. We have so many resources locally now. If for some reason that you are having some issues with breastfeeding, reach out. We have a lot of free resources within our metro, and more providers are becoming IBCLCs and CLCs. And so that way you can have assistance either going to them or in your home. So I'm hoping that everything I have been able to share with you all have been very beneficial. Again, I want to end with that most important 800 number. If you have a care provider that is not versed or educated in mood and anxiety disorders, whether it is impacting you as you are caring and nurturing your baby or after, this is a resource that is free to them. They have expert consultation. An expert will return their call within 24 hours so that they can have a role in your care. And again, that number is hosted by Postpartum Support International. It's 1-800-944-4773, extension 4. Again, I am Danielle Lugrand. I am an advanced certified birth and postpartum doula, a certified lactation counselor, a certified Lamaze childbirth educator, and midwifery student in my primary phase. And again, a board member of our up-and-coming Postpartum Support International Oklahoma chapter. It has been well. If you have any questions, post below. We have a vast array of professionals on our board, and someone will get back with you timely. Thank you so much. Bye-bye.